So, people, my name is Brad Montgomery. I am super excited about today's guest because Elaine Morrato, besides being a very old friend, Elaine and I have known each other since college days, Elaine. But her career has been on fire, yo. She's pretty much, for someone like me with a right brain, non-sciencey bit, she is the opposite. She's just a total rock star with science, and she gets it, and she has a really deep history most relevantly in epidemiology, and she is going to tell us a little bit. Would you tell us a little bit about your background, Elaine? Because I think that's important. We need to let them know that you really know stuff.
Okay. Is this okay? Or is the sound coming through
That
fine?
is
Okay.
perfect.
Yeah. All right. Yes. Hi, everyone. And I'm delighted to be here. And it really, hopefully, is a cup of coffee kind of conversation to answer questions. I'm currently the founding dean for the Parkinson School of Health Sciences and Public Health at Loyola University Chicago. I previously was at the Colorado School of Public Health at the University of Colorado, and have also just completed a 2-year stint working with the U.S. Food and Drug Administration in their Centers for Drug Evaluation and Research. And early in my career, I worked at Procter & Gamble in Cincinnati developing new medicines. So I've always enjoyed this intersection between the science, how you relate science to practice, and how do you help educate and inform and come up with strategies to improve health of people. So, and here I am, new as a new dean in the middle of a pandemic. And so we're all living through this together in real time.
Yeah, welcome. Hey, you got a really fancy job in a new city, and we got a pandemic.
Pandemic, yes.
Um, can
Make
you?
it work.
We've been advertising you as your friendly neighborhood epidemiologist, which is a phrase you came up with. What's
Yeah.
your connection to epidemiology? Can you explain that to me as a
Yeah.
non-scientist?
What does an epidemiologist do? So it's someone that really likes to understand how diseases are transmitted in the world and um, risk factors for that transmission of disease. And historically, humans have been most susceptible to infectious diseases. So a lot of epidemiologists focused first on that. In the last century, we focused on diseases like diabetes and heart disease, but it's really just trying to figure out how disease occurs and how do we come up with prevention strategies so that we minimize the impact.
If you're like me, what I just heard between the lines is, "Oh, goody, she knows what we need to know." And then also with P&G, you were, if I have it right, Elaine, you were bringing drugs to market through the FDA, and then you went to the FDA and were helping bring drugs
Right,
to the people, right? So
correct.
you have insight on this process of vaccines that we all don't understand.
Yeah, or certainly understanding of how the FDA reviews new applications, whether it be a new drug or a new vaccine. I've been involved in sitting on FDA advisory committees that review the evidence in a very transparent way and give advice to FDA. And I note that there's an advisory committee scheduled for early December to review the vaccines. And so it's not just a committee reviewing it, but we all as Americans get to see the briefing documents and all of the information just like the experts. And that, I think is a very important part of what FDA does and is a good thing in our country.
Well, thank you for being here. As you know, Elaine, I come from a family of lawyers. And I
Yes.
think if we were in court, we would say, "I'd like to stipulate that she is, in fact, an expert." Right, she's an expert. So having that very important detail, I hate to call your life's work a detail, down. We want to know about COVID. So I've got some
Yes.
questions people have emailed me, and I
Sure.
have questions myself. And what we really want to know
Yeah.
is, what would you tell us to do? What can you recommend? Help us make sense. And the biggest question to start off is, so how big of a deal is this pandemic? It doesn't seem like we agree as Americans. What's your take?
How big of a deal is it, you mean?
Yeah, is this like emergency? My hair's on fire, or is this just
All right.
wash my
This is,
hands.
yeah. All right. I'll walk you through how I think of it. I mean, on one hand, no life lost. I mean, one life lost is a life that shouldn't be lost, right? So on one end, there's that human element, and if that life lost or life affected by a lifetime of chronic illness because of having COVID, has significant impact on individuals and families, right? So what makes this hard is that if you've had that impact, it's very real. And so it falls into how do we perceive risk, and how do we perceive the benefit and risk, because people are also affected by mental health, they're affected economically with this. So this is a hard question. But let's look at statistics. I looked up today that in the United States, there were 1,032 deaths yesterday related to COVID.
Wow.
We've had 100 and we're projecting right now by March, 470,000 deaths. Okay. We're in a resurgence of a wave, and we're estimating that in January and February, 2,500 people will die each day. Okay. And if you think of that in context, how do you put those numbers into context? We have the third highest mortality rate per population in the world. We have the highest number of people have been affected. And if you look at the number of people that will be dying at these surges, it's like the equivalent of 9/11 every 2 days. Mm. And so it's sobering in that regard. Now, many people, not everyone dies from it, right? And so for the vast majority, it's like a very bad flu. But for that, 15% of people that require hospitalization, and that 5% that might require intensive care, might be on ventilator, might have lifelong chronic. For that set of people, that's really tragic. Another way to look at it, Brad, is how does this, because a lot of people make this comparison, how does it relate to the flu? It's probably 4 times more deadly than the average flu season, at least, right? So you could say, well, gee, we have that flu every year and we don't worry about that. It doesn't shut down our economy.
Yeah.
I think what's different here is we have strategies around dealing with the flu. We have vaccines. The flu affects people that we know predictably. And we've been learning a lot about how COVID works, and we don't fully know everything about it. And that makes it a little scary as well, because it's brand new for us and it's just ripping through the population, right? Whereas flu, most of us, we have built up immunity over time. And so right now we're living at the very beginning of an epidemic, and everyone is susceptible. And so that can be scary. So part of it is the numbers, and part of it is, has it touched you personally? And part of it is, we all have different risk perceptions too, and how we process the unknown.
Yes, and I get that. And one of the things I'm so grateful to you for being on this thing with me is because I understand what you say when you say we all have different risk perceptions.
Yeah.
And I get it that it's different for every person, but all of us, I think, like muggles like me, I just want someone to tell me what they think is safe. And so with your permission, I'd love to make the conversation a lot about you personally. Yeah. You are Dr. Elaine Morrato. You have kids. You have a husband. You have a job. Yeah. What do you feel is safe?
What do I do? Yeah. Okay. And this is hard, right? So we're tired. It's very easy to let down. It's like other health things. Yeah, I know I need to eat healthy and exercise every day. And then there's sometimes where you just forget it, right? All right, what are the basics that, the basics are wearing?
I'm thinking grocery stores. Do you do that? Would you go to Walmart? Do you have things delivered because you're chicken to go out? Would you go to a patio restaurant?
Yes, I've done all of those things. So Um, what I'm looking for is the behavior of people around me, right? The data is showing if we wear masks, if we socially distance, 6 feet, we're not in people's spaces for more than 15 minutes. If we associate with people that are also being equally safe, then the risk is much lower than if we're in settings with people we don't know how they're following. So I live in Chicago, and in Chicago, they've just re-implemented guidance, right? So when I go to the grocery store now, they will only allow so many people in the building. And so that's ensuring that there's spacing and good air circulation. And, maybe early in the pandemic, it felt very scary to go to the grocery store. I think the evidence now is everyone's wearing masks. That really reduces risk. So I feel the same way by going through the airport right now. I just flew a week ago, but we chose to fly direct. We chose to fly in an airline that I knew had spacing and it wasn't super crowded. I certainly was washing hands before and after. We're just trying to use good hygiene as well. But I'm healthy. I think if I was older, like my husband's parents, he's 80, he has pulmonary conditions. No, those aren't safe practices. So you have to also look at your own personal risk, and you might live in a household where you have to take care of someone that's like that, and so you're going to do things differently. But essentially, people generally following that does well. Where most of the transmission's been happening recently, Brad, is people getting together and getting tired, and small families are getting together, or you decide, hey, let's have one more ring of people, not my little bubble, but let's have a couple or 2 or 3 families get together. And now you start to mix up the population, and that's where a lot of the spread's happening right now,
Oh,
which is the concern for Thanksgiving, right? So,
right. You're ahead of me.
yeah,
I want to get to that, but I want to go back one because you said you flew a week ago, and that was a big
yeah,
question. I've got 2 people
yeah.
who asked me about flying. So all what we read about air filters on planes, you feel obviously you did it, so you feel like that's a go.
If you ask an average epidemiologist, they'll give you different answers. All of this is a probability, right? And you're trying to look at the risk of different things you do relative to your background risk. So if I'm living in a community where COVID's very much around, and there are hot spots like that, the risk of being on an airplane is less than what your background rate is locally. I do believe the data that came out of airplanes, that they have good circulation of air, that they have good filtering. Everyone is following good masking and cleaning policies, and
All right.
so
Well,
I personally trust that.
I'm going to get to Thanksgiving. I'm just holding that out as a
Yeah,
teaser.
yeah, yeah,
Um, Imagine you want to go across country to visit family or whatever, a state or 2 away.
yeah,
Better to
yeah,
fly or better to get in a car and deal with, the days in and the rest stops and the drive-through?
yeah. Okay, so early in the pandemic, we were moving from Washington, D.C. to Illinois. And so we've had to make that decision. What do we do? Do we drive or do we fly? So if you think of the general goal is to have the least amount of human contact, driving would be safer, right? And when you go and stop at rest stops, you can be just washing hands. I know when I went to the gas station, I had a bit of wipes with me in the car. I didn't touch the pump. I just used it with a wipe. Some people will use, rubber gloves, that sort of thing. But I can control that, right? I'm in my own car. I'm just outside getting gas. So the risk is very, very low there. And in a lot of those large rest stops, they had been very underpopulated and
Right.
that. So
How about a
it probably
motel?
depends on the state you're in now.
How about a motel?
Since um, The motel, the data is basically saying that you don't get a lot of transmission on surfaces, right? So early on, people were concerned like high touch surfaces. It doesn't mean zero risk, it just means it's lower risk. And so if you trust that that hotel is doing very rigorous cleaning, I think you can feel more comfortable.
Do you trust them?
I mean, the thing is, in life, there is no zero risk. Going outside in the sunshine, you have risk of developing skin cancer, right? So we use sunscreen. Does sunscreen mean I will never get skin cancer? No. But I use good practice. I wear a hat, I wear, sunscreen because I'm trying to reduce risk. So I see things all as relative. It's, you can't say I have no risk. You're trying to do informed risk taking and mitigating as best as you can.
When you drove across the country from DC to Illinois, did you stop in a hotel?
I did not. At this time, this was I think April and May. I think it was in April. And there's a lot more we know now than we did then. And I chose to drive the 11 hours straight.
All right. And if you had to do it tomorrow, would you break it up?
If I if I trust the cleaning protocol of the place I'm staying. So this is no different than some of your listeners might buy vitamins, right? And I would say the same thing. The way vitamins are regulated, you have no knowledge of whether or not they're produced safely. And if they say that they have a certain amount of the vitamin in that pill, you don't know if that's really been checked because we don't regulate it. So you've got to buyer beware, and you've got to say, do I trust this particular buyer that I'm getting stuff from?
Kim and
So I know it's in the best interest of corporations to make sure they're doing this right, because if they have outbreaks like the cruise lines, they've shut down. It has huge economic consequences. So maybe I trust the free market in that I think good companies are trying to do the very best that they can, and I look at what they talk about that they're doing.
Elaine, I tend to think of myself as about the most optimistic person in any given room. But when it comes to this, I am way more cynical than you are. Kim and I, my wife and I, drove to Virginia to see her parents and back, and we definitely stayed in motels. And we are not epidemiologists, so we're just nervous. And it came down to this, not thinking, does Marriott have a system to tell their Courtyard by Marriott to clean? Yes, for sure. The question is that one guy who's paid minimum wage really doing it?
Right.
And so we were just spraying everything down. We just kind of felt like idiots.
No, you're not being idiots. You're not being paranoid. I mean, you can also say when in doubt, do it. I mean, there's nothing wrong with doing that. So in that case, what you're raising a really good point, which is context matters, right? So if that particular hotel was in an area in which the state has certain policies, everyone is in the community following good practice, then I might have more confidence that people are following through on that protocol. If I'm in a community where people are saying, this is ridiculous, I don't need to worry about it, then I have lower confidence that they're following that protocol. I can't, So context matters, and as a public health person, many of us are just appalled how politicized a lot of these just basic, what they teach us in the textbooks, basic 101 on infectious disease, how people are just balking at it. So that's very hard for public health people to understand, I'll be honest. And so, it makes it hard when every state is reacting in a slightly different way.
I get it. Let me ask you more questions. And the questions are, would you do this? You said you already have, you'd sit on a patio right now. And the following questions are, some patios are adding a partial tent or a wall, and then they have two walls and three walls.
All right.
What?
Yes. So really the best indicator on if I'm comfortable being outside, like at a restaurant, is that what you're saying? Like a
Yeah.
patio restaurant, is really understand what your background positivity rate is. So do
Background
you know
what?
what that is? Yeah,
No, no idea.
positivity rate. Okay. So think of it as like you're taking the temperature of your room, right? And is the room very hot or is it cold, right? So the positivity would be of everybody that's getting a COVID test right now, what
Sorry about
percentage of them are coming back positive, right? So
that.
if your
Okay.
background rate in your community, and you can look this up, your local or your state public health department, likely if you go to their website, has a dashboard and they're tracking this. This is one of the key indicators to see how well are we doing, right? So if that background rate is 1 or 3%, it's very low. And if I trust that restaurant, and how it's set up, and I'm outdoors where you get good ventilation, then I'm okay, doing that. The evidence says that it's not really being transmitted by food, right? So I feel okay. The key thing is air circulation. Yes.
I'm sorry, because remember, non-scientist, right brain guy.
Yeah.
The positivity rate is the number of people who are getting positive COVID tests versus negative positive COVID tests.
Right.
All right. Well, then let's be specific. In Colorado, I read that today it's between 10 and 11%, 10.3 or something.
That's very problematic. That's bad. That's not good.
Right. So
So
what does that mean for us?
ideally, yeah. So yeah. So another way to think of it is if I ran into an average person on the street, how many people would I have to run into before I run into someone that probably has COVID? So 10% would say if I just bumped into 10 random people in Denver, 1 out of 10 will have COVID. So now you just say, if I'm that's why this relates to why they have these restrictions on how many people can get together. They're looking at what's the probability that you're going to bump into someone that has COVID. So ideally, we want to be down at the 3% or lower. 5% to 10% could be manageable if we have good testing and that. Anything over 10% is considered just red zone. That's how public health
Right.
people will say that there's a red zone going on here.
What's the difference, though? Because I just know Colorado. So for those of you outside of
Yeah,
Colorado, I'm sorry. Colorado, according to the governor, he says 1 in 49 people in Colorado have COVID. But for people who are taking tests, 10% of the people taking a test are getting positive. What? How do you? What does that mean
how do
for?
you match the two
Yeah.
numbers?
What is?
Yeah.
I don't understand. Like what?
So is the governor saying 1 in 49 have it right now, or 1 in 49 have had it from the start?
I think it's the former, but gosh, I hope we're
Yeah.
not betting money on this.
Yeah. So the difference is like incidence of it versus cumulative, or I guess I would say prevalence. Every day we get a number that's incident. It started today. Prevalent means, gee, they might be sick for 3 weeks, 5 months, 10 days, 3 days, right? And so that number he's giving you is probably the prevalence rate that represents people who have it right now, which is they got it today, as well as have had it for a period of time that they've been sick, right? They've stayed positive. Whereas the positivity rate is saying of the people who got a test in this group today, here's how many are testing positive.
Right.
And they're measuring different things, and what you try to do as an epidemiologist is compare it to what's going on in other states, and what's a number that we look at, not just the number but the change in the number, right? So before I got on, have you looked at the New York Times data? Have you ever looked at that as a website?
Yes, I have, and the little tiny arrows that go up and down, and they're red and
Yeah,
yellow.
yeah, but you can look up Colorado. Have you done that?
Oh man, I feel like I'm being called up by my biology teacher.
Well,
I can't
I
answer
would,
that for fear I'll look like an idiot. No,
yeah,
I
well,
haven't.
I would agree with you. They have it by state. And I would say the New York Times has made this publicly available. I like using the New York Times because the pictures look nice, and they try to give information in a way that's useful for the lay citizens, right? And in there you can drill down and you can look at these different numbers by state, and you can look at, well, how is Colorado doing relative to other states in the country? And if I were in a state that has been traditionally looking pretty good, then you could say, all right, my system is working. If I'm a state that is one of the worst in the country, that would say my system is not working. And I would feel personally, I need to be much more, my personal system needs to be more cautious if I'm in an area that there's a lot going on around
Right.
me. Does that
Elaine,
make sense? Yeah.
yes and no.
Yeah.
Because I understand everything you're saying, but also I find myself thinking, oh, brother, am I really going to do that? So, is there one of those numbers, the infection rate or the prevalence rate, that I can look up and then know a guide point? Meaning, if it's above this number, Brad, don't go out. If it's below that number, you can go out a little bit. Is there like a magic thing I get to just a guidepost?
Yeah. And unfortunately, this the strength of our country is that we have state government and autonomy, and federal. The downside on managing through a pandemic is that each state is making that determination of what's a good number. And so there's probably some variability in that. I think the positivity rate would be, ideally you want to be less than 3%. 5 to 10 is, it's like an orange code. And if it's over 10%, I mean, there's huge problems going on.
All right. Well, that's
Um,
that's that's very specific, and that's very helpful.
yeah,
Positivity less than 3%, I can feel a little bit better.
yeah. I mean, ideally, you want it to be zero.
Right.
Some countries, like New Zealand, have gotten it to zero. That's where you want to be, right?
Yeah.
And when it's at zero, and if you have really good testing and surveillance, then when you have that, think of it as like in Colorado, you have like, do you want the forest fire that's out of control? Or do you want to have really good fire mitigation? And when you see a little spark, you can tamp it out really good. So the contact tracing and control is how good are we paying attention to where there might be little brush fires, and we put them out right away. That's why we do that. So that right now we don't want to have uncontained forest fire, and that's like the equivalent of an uncontained pandemic.
All right. You're good at this. I think what I'm learning between the lines, and maybe I just already knew it, but it's nice to hear it from someone who I trust. It's complicated, and black and white yes and no's are not easy.
No, and we shouldn't shame one another either, right? So, um, yeah, there, it's a lot of different perspectives. I'll admit, I had a lapse for myself, right? My son was roommates was exposed, and it came back positive. My son had no symptoms. It was maybe 9 days since he had contact with his roommates when they first started having symptoms. He's looking fine, and we had planned to have dinner. And he had gotten his COVID test the day before. He thought he'd have results, but didn't. So I had to make a decision for ourselves, right? So I decided, oh, come on over. And then he ended up positive, and then we had to deal with it. So these are natural. We're all trying to make choices, and everyone is fine, unfortunately. And, sometimes we get worn down. I mean, and maybe in hindsight would have made a different choice. So that's okay. um,
Well, that's such a
we're
personal
human too,
story.
right? Yeah,
All right.
yeah,
But that's helpful to know that even you with hindsight might have changed your mind.
yeah. I should have.
Well, I'm going to get back to some more really specific. Would you do this? Um,
Yeah,
I I'm selfishly going to ask you about my life. I've got a college kid
yeah.
who's at a big state college here in Colorado. He lives with three other boys, and we don't know anything about those boys except for that they have jobs. And my son works at a restaurant bar. Well, guess what?
Oh,
He'd really like to come home for Thanksgiving. So his last day of work was Sunday, where he was a server. And the restaurant wasn't that crowded or whatever. Two of his roommates have since left town. He got a test on Monday, yesterday. We should hear, I don't know, today or tomorrow, if it's positive or not. But I don't know what that means. And do I let him
okay.
in
All
our
right.
house?
Okay. I'll tell you this. All right. So, remember when we were little and we could get chicken pox? Do you remember? I mean, half your audience probably has no, what is chicken pox? All right. So there is this thing called an incubation period,
Yeah,
right? And that's the point in which you might be positive, or you might have it, but you might not have shown symptoms, right? On average, or that can be like 14 days. So that's why we say from the point in which you're exposed, you need to be isolating for 14 days, right? You might not, and early on, it might take a while for you to build up enough antibody or enough of the virus for you to be detectable, right? And so, on average, maybe around 5 days is when symptoms are emerging, and you can be negative before you start to have that you're positive. So, if you really wanted to be safe at your household, you wouldn't have them home for 2 weeks. If you wanted real safety,
but Elaine, Dr. Elaine, I
yeah,
thought that the
yeah.
testing was our nation's technique to shortcut the 14 days.
Not really. Not unless he's testing every day. Is he like testing every day?
No.
Yeah. So this is what happened with the president's administration. They were doing regular testing. I haven't even talked about like sometimes a negative test doesn't mean that you don't have it, right?
Right.
Tests aren't perfect, right? But let's assume we have perfect tests. He, if he got exposed to someone on his last day with the waiting, right? He might not they tell you to wait 5 to 9 days after contact to get the test because on
Oh, I
average,
didn't know that.
yeah, yeah. So 5 to 9 days, usually you're going to have whatever enough viral load that it will be detectable. So that's like after Thanksgiving.
Right.
So what are you going to do? You want to see your son. What are you going to do?
I well, I'll tell you what I made up, but this is why I'm so glad to talk to you because I have very little
Yeah,
confidence that I have this right. We said take two tests. So we took a test yesterday, that's Monday, and
yeah,
take another test on Wednesday. And then
yeah.
once we hear from both of those tests, then come home. But what I just heard from you is that is way too fast.
Could be. What's his behavior right now? Is he going out?
Well, I know
I,
10 days
I
ago he
doubt
was in
he's.
a 12 days ago he was in a crowded bar. I know that.
Yeah.
I don't think
Okay.
he's been in a crowded bar since, but he has been in a sparsely populated restaurant right in their faces.
Yeah. Yeah. I
he's
mean,
with
it's
a
all. It's all. There are certain workers that are. There's some data indicating that it's not just like amount of exposure, but a cumulative exposure. Like our bodies might be able to bounce off, like we get exposed to some, but if we get several of exposures, then suddenly we start having the infection. So he's in some ways, a frontline essential worker. Um, so, the ideal situation is you would say, okay, honey, I'd like you to just self isolate or, be very minimal in your exposure outside and wait the 2 weeks and come home. That's what that
all
would
right.
be the safest.
Ugh,
But that's a
yes.
really hard thing to do. All right. So what do you do other than that, right? This is where it's hard. Everyone's making their own personal calculation. Let's say you wanted them home for Thanksgiving dinner. Can you have your Thanksgiving dinner outside?
Well, right now it's 32 and snowy out there.
Yeah. So may not work in Colorado. May work if you're in Southern California.
Plus, okay, here's
Yeah.
a related question. Let's. I have so many questions. Would you have people over today on your back patio? So you and your husband and two other people. Would you have two guests on your back patio
Okay.
today in
Right. So
Chicago?
yeah, it depends on how well I know these two other people and their behaviors and how well they've been isolating and following good practice, right? So um, if and also if they've had COVID already and maybe they have antibodies and that. So um, I don't have a back patio. I have a balcony. I'm in an apartment. So I would say I don't think I would want to do that because I'm in a 5 foot by 10 foot
Right.
balcony. I'm outdoors, but I'm in an apartment. If I was in a house and I had a back patio and I knew the couple and we're staying, I've done that. We met some people for brunch and we were outside on a patio and we stayed our 6+ feet and we were outside and you know it, I felt okay with that.
Would did you use their restroom?
I did.
So you went
I,
indoor.
yeah, I did. Um, and washed my hands really well.
Oh, that was a
But you're
big one
right.
I
I
wanted to
mean,
ask.
yeah, you're right. I mean, that's where the air circulation makes a lot of sense. I guess if I was completely correct, I should have put a mask on when I went into their house, used a mask while I was going to the bathroom, washed hands, came outside. I could take my mask off.
Dr. Elaine, look at this from a beautiful person named Claire Montgomery. Last name not important. Does the fact that your husband is a teacher interacting with students change your behavior?
It's changed our behavior. Um, so where he's teaching is in a portion of Chicago that has much higher background rate of COVID than where we're living right now. So some things that we've done is when he comes into the house after teaching, he takes his mask off right away. He's and he takes a shower. And that's one way, and it leaves clothing at the front door, right? So that it's, we have it set up so that he's not just throwing clothes off. But I mean, we have a process where he comes in, it's kind of like if, it's not like what you would have seen on the movies when they go into the, virus contagion tank, it's not that severe, but we're trying to do that. And again, it has to do with cautious behavior. He works in a school that they are meeting in person, but they've really implemented practice. Everyone wears a mask. They have social distancing. They're trying to do everything possible to maximize all of that. So we're trying to follow that. So I'm fortunate. I get to work in a university in which I'm here at my desk on a computer. And so none of us go into campus to teach. We're teaching virtually, or I have my meetings virtually. So my exposure is actually very low. So my personal risk is my husband coming home with something
Yeah.
most likely. And I
Well,
don't go out to bars. So,
uh, okay, so here's a question again about my family, but I suspect
yeah,
many people have something similar. Um,
yeah,
I'm ridiculously safe. I have four people living in my house, my wife and I and two kids. Three of us are pretty much shut-ins. We're crazy safe. The fourth one works at Starbucks, and she
yeah.
works in a small Starbucks. It's takeout only, and we call it a box. She's in a box with five people or five total, and she doesn't know anything about those other people and how safe they are and who they live with.
Yeah.
Are we insane, Elaine, for letting this happen?
Well, how do you feel about it, Brad?
Nervous.
How's the family? Yeah,
I feel balanced because it's really good for my daughter to have something to do.
yeah,
It's fantastic, and well, that's clearly for our family. That's the weak point, and we don't.
yeah,
I'm really troubled.
right. So this is where it comes back to personal risk perception, right? nothing in life is risk-free, right? So how do you feel if you were driving a car and you didn't put your seatbelt on?
Bad.
Yeah. Does that mean that you won't die if you get in a bad car accident?
No.
No. So the seatbelt is helping reduce the risk, but it's not going to prevent a bad outcome. So wearing masks, cleaning hands, all of that's reducing risk. I mean, there are some studies that have shown if everyone is doing that, that the likelihood of transmission is really reduced. There's a classic study that came out of the CDC looked at a hairdresser salon outside of St. Louis. Two of the stylists had COVID,
Oh.
but they were wearing masks. All right, so one stylist had COVID. There were a couple of other hairstylists. I think there was like, I don't know, 50, 60 to 70 or 80 people, they cut their hair. And they looked at this, right? And the shop was following all of the protocol and wearing masks and that. None of the people that they cut their hair got sick.
Wow.
The only person that got COVID was another stylist, and I think these people shared a common eating room, right? They had lunch together, right? And of course, they had their masks down and stuff like that. So there is data that would say if we just wear masks, it really does dampen the overall effect of transmission. Or if things are being transmitted, you're getting much smaller dose of it, right? Than if I'm here shouting at you.
Right.
Yeah. So it's all relative, and that's what makes it hard, because our human brain wants to have absolutes. They want to hear it's good or it's bad. I won't get it,
Yes.
I will. It's like
Yes.
having surgery. Most surgeries go just fine, but there's like that 1% that doesn't go fine. But we still make a decision to have the surgery because we want to have a better knee, or we want to have a better hip, or whatever, right? So in the drug area, if you go in informed and benefit risk, and for some, the mental health, the economic wellness is important benefit, right? And so if people are making that calculation and trying to mitigate as best they can safely, that's the only way we're going to get through this together.
But permission to ask you a follow-up?
Yeah.
So would you
Yeah,
let
yeah.
your kid work at Starbucks
Would I let my kid work at Starbucks? Well,
when they're living with you?
yeah. Well, I let my husband work at a school, and he's there with more people than she's working at, right? So yes, I would. But I think, yeah, you just have to, so what does she do when she comes home?
She
Does
washes her
she,
hands, but she doesn't strip by the front door. She just washes
yeah,
her hands.
yeah,
And her mask is in the car.
yeah. So I might suggest maybe she does a more often mask changing. Is it a reusable mask?
Yeah, they're paper masks at Starbucks. You've seen them.
Do they give them? Yeah.
They're
Do
not
they
the
give them?
N95s. They're just the
Do
free
they give
ones.
them? Yeah. Do they give them new ones each time?
Yes.
Yeah. Well, she could be using. You could pay the extra money and help her have fancier masks. I don't know the kind Starbucks is using. Maybe it's a good.
Yeah.
But my sense is I buy yeah,
That's a
okay. So
Starbucks mask.
it's a regular surgical mask, yeah.
Yeah.
N95s are better. I mean, it's all relative again, right? I'm not saying that's a bad mask at all. It's yeah.
All right. So
I
here,
buy at Starbucks, and I know Starbucks is following very closely local state regulation, and they changed their practice. I would say they have a very based on what I've seen, a very good implementation. Like the Starbucks here in Chicago, the mayor just changed guidance, and that day they were changing as to whether or not you can have food inside or not.
right.
I would imagine, yeah, are people wearing masks when they come in to pick up?
It's drive-through only.
Drive-through only. Okay.
Claire wants to know what are the fancier masks, and what are you wearing N95s when you go grocery
I
shopping?
don't. I don't. I wear a cloth mask that has the levels, which is found to be pretty good. But I'm not I'm choosing to shop when there's not a lot of people. I'm not working in close proximity. So I know when we traveled on the airplane, we wore an N95. Again, you're just trying to shift the curve a bit. It's not like you're going to, we
Yeah,
can't kid ourselves. It's not like we're wearing the hazmat suits that you see on the movie when you go into those, I'm dealing with the Ebola virus. We're not walking around like that, right? So we're just trying to shift
I
shift
get
the
it.
curve. Yeah.
All right, Elaine, your awesomeness, your royal awesomeness.
Yeah.
Let's switch to vaccines because you have a, a really perfect perspective with your work on both sides of that FDA fence. From what I understand, we have three different companies saying they got vaccines.
Yeah.
What does this mean? Am I going to have to go pick one? And like, can you, what do I need to know
Yeah.
about vaccines right now? Because it feels overwhelming.
Yes. And all right. Do you remember back early on in the pandemic when we were talking about diagnostic tests and how am I supposed to know what's a good diagnostic test or not?
Yeah.
Yeah. So we're going to see the same thing play out with the vaccines, right? So FDA's view is not to choose one vaccine, and that's the one that we implement. Their job is to make sure that there's a certain safety and efficacy standard that's achieved, right? And then the idea we have in the United States is that we let our free market determine which is the best alternatives. Okay. So there's a few things. The very good news is that at least what's being reported in the news is that the efficacy of these vaccines is far higher than people were initially thinking they might be. In an average year for flu vaccine, there may be 40, 60% effective.
Oh,
Yeah, and yet we still do that. The difference is that the high risk people all get it, and we have a lot of people who have had flu, and there's probably built up background. The virus just changes a little bit each year, so we have a different immune response, and it's not spreading as its infectivity is not the same. But so to see a number that's over 90% is like unbelievable. If that plays out in what we see when it goes through scientific review at FDA, then that's really great news. Then the challenge then goes to, well, they'll call it like, how do you get the last mile? Or how do you get it from the vaccine to actually to people? And that's the distribution channel. So how many doses have been made? Who gets the first doses first? And these early vaccines require very special handling and like a cold chain.
yeah.
And like one of them is like really cold. So that's not going to work if you're in the mountains of Colorado or on the plains of Wyoming. So some of those vaccines only make sense if you need super cold storage to have them in major urban centers, because those are the places that have those kinds of facilities. There's a vaccine that has just been talked about more recently that's going to be submitted. It looks like 70% effective, but it's much easier to distribute. So, what you're going to have is probably a mix of all of these things being used in the marketplace because the demand is so great that we're going to need to meet the demand and supply. What will get debated, because each state gets to come up with their own distribution plan, is who gets the vaccines first. These tend to be high risk or essential workers. So if we look back a decade ago when we had the H1N1, the first people who are likely to get it are going to be healthcare providers, other first line responders type, maybe high risk people. The elderly are the ones that are most at risk, or others that may have immune.
But
And
going
so
back
that means people like us may not even have access to these until next summer, So
well, that you're ahead of me on that question. because we want to know when. But do you foresee me being in Walmart texting you saying, which one should I get?
No, you're going to get what your providers say is available.
Okay, nice. I don't have to choose. All right, well, I'll warn you because I don't want to
Yeah.
I'm worried about taking up too much of your time. I'm going to end with what gives you hope. But can you tell us when you, with all of your expertise, see things looking like we're vaccinated? Like, I'm in the live event business. When are we going to have live events? When do we get to go to restaurants? When will opening schools not be such a big question? When is
Yes.
it going to be normal?
Well, I think if you just play the averages, and you listen to like experts, we're going to be rolling out vaccine this winter and spring and summer. Um, the question will be probably not, is there enough of the vaccine, but more or less, do people want to take it? So what is going to be vaccine hesitancy or refusal? And what proportion of Americans will be taking it? It's estimated that we need about 60 to 70% of Americans to be immune,
Wow.
whether in order for us to get back to normal. So the question is, how quickly do we get to that?
Right. That is the question. And now, to answer that question, Dr. Elaine Morrato, what do you think?
What do I think? Well, there's going to be huge demand and market push to get vaccine out. So maybe that we'll figure out all the distribution channel. There's going to be a lot of effort on that. I personally think that we're like a year off before people are talking about 2020, late 2021 and early 2022 before quote normal, if we think about getting back to what it was like right before the pandemic hit. Then the question will be risk perception on the back end. I mean, you watch movies and you see like, man, those people they're getting like too close. So there will be a residual of people just not wanting, wanting to be out. So for event planning, I think people are not going to feel comfortable for doing that this year, 2021, that is. But maybe big events in 2022.
This is my sad
I
fate.
mean, I know. And it's going to depend on where you live in the country and how people are deciding to manage through risk. Some people will say we need to be opening those things out. So what would you do, Brad, if a state decide, hey, everything is good, we have vaccines now, let's have big meetings? Would you go to them?
I'll probably call you first. Well,
Yeah.
okay, that's a real thing. I have a client in Alabama who has scheduled a live event, wait for it, in February in a hotel, in a banquet room. What they say they will do is all the correct social distancing stuff, and I'm positive that the meeting planners will enact that. I am not positive that the attendees will follow them, and I don't know what I should do.
How many people will be there?
I'm going to make it up. I think it's about 180. So it's not a huge one, but it's, if you had 100 people, 180 people in a restaurant, you'd notice it.
Well, you can look at the CDC has guidance for event size and density. And you could look at that and you could say, okay, are they, you could say, I want to make sure there's a certain positivity background rate for Alabama where you are before you commit, and that you make your contract contingent on that. That's exactly we had political rallies with large groups, and they can become super spreader events.
you're,
Yeah.
you're like,
I would, my gut would say I would not do that unless I was seeing Alabama looking really, really good. And maybe they
okay.
are.
You used to be my friend up until that moment right there.
So, all right. So I'll give you another website. Remember that you may have heard in the news, the University of Washington
Yep.
has a modeling, and that's So there's a website that is COVID-19, and it's the Institute for Health Metrics and Evaluation, IHME. And if you go look at their COVID data, they're trying to project out as best they can. No, it's a projection, it's a model, best guess.
Right.
You can look up Alabama, and you can see what their numbers are looking like.
You said IHNE?
M is in metrics.
Metro, IHME. There you go.
Yeah.
All right, I'm there.
Yeah, that's what I'm looking at, right? And I'm looking at, okay, Oregon is looking pretty good. California has been looking pretty good. And you say, okay, these are states or areas where the systems seem to be working, and I can trust the system. And so you want to look to say, is Alabama looking good for you?
I'm there. Before I ask you what's giving you hope to close this thing up, is there anything I should have asked you up to this point?
Should have asked me.
Did we leave a whopper on the table? Did I leave something obvious out?
Let me. I'm trying to think.
Elaine, would you?
Oh, I know what. I know one. Yeah.
Go ahead.
Be very conscious of it. You touched on it a little bit. There's a lot of pandemic fatigue. And we already have in the United States about 1 out of every 6 people are dealing with some form of mental illness of some type: anxiety, depression, stress, right? There are estimates that that's gone to like 1 in 2 people are feeling more anxious these days because of COVID. So make sure you have a mental health wellness plan, not just a physical wellness plan around, wearing a mask and washing hands. Do you have things that are going to be calming, rejuvenating, a sense of purpose, gratitude, meditation? I do yoga, whatever it is, because I think living through these times in isolation is as much of a drain on our mental well-being as it is on like physical risk, because we're not designed for chronic risk like this. It's, the fight or flight or freeze is how we're naturally programmed to respond to threats.
Yeah.
And so to be in this chronic state is very draining. And that's why it's very easy to slip up and, develop fatigue and just say, oh my gosh, I'm just really tired of this. And we're mourning what we don't have right now. Like, I have nieces and nephews who are like living their senior year in high school, and it's like, this is not what they wanted for their senior year. And so I think that giving time and attention to the mental wear and tear. And my favorite expression right now for myself is, I am enough and I am doing my pandemic best. Aww. Right? It's affecting everyone, and it's affecting children. It's affecting, the mental around school is different. I mean, this is traumatic, and we have to acknowledge that and process our emotions, not just process the physical stuff. So that would be my other thing I think is important.
Well, Elaine, between the two of us, I am the motivational speaker, but you nailed it. That's really fun and makes my heart feel warm to hear you. As you're coming in with data and science, and check out this website, and then what I left out is the mental health piece and self-care. And dang it,
well, that's why it's fun. I mean, what you're doing is fun. I mean, we're all going through this together. And I'll be honest, I'm an epidemiologist, but I'm not an infectious disease epidemiologist. So maybe I know a little bit more epidemiology than you do, but I'm reading daily the science as well.
Can we just say there's no maybe?
Yeah.
There's no maybe you know more than I do.
I know more than you do. But every scientist is trying to read and learn in real time as well. We're all trying to do our very best. And sometimes we have to be comfortable with changing what we do based on new information. That's also very hard to do. How do we stay agile and flexible and say, okay, there's new information on masks now. Okay, I need to change my behavior.
Right.
There's new information on whatever now. All right, I need to adapt it. And that's tiring. I know. So you wanted me to say what gives me hope?
Yeah, like, and you can be as broad as you want on this, but
Yeah,
just like you said, I am not alone when I say I am up and down. I have good days and bad days, and I think everybody out there on the planet has good days and bad days, and the people who don't are lying. That's what I think.
yeah.
But so, what do you, here you are, a very bright person who's done well in life. What gives you hope?
Yeah, what gives me hope is, all right, what we're living through right now is public health 101, right? When I went to school, they said it's not if we're going to have a global pandemic, it's when. And at that time, you're like, yeah, whatever. Okay, I have to study this so I can pass my test, right? But they're absolutely right. And I wrote about, and I had to give the commencement to our graduating students this last May. If you look at the last 100 years, we've had 5 flu pandemics. I would say what we're experiencing now is worse than most of them, except for the 1918. But we, as a human society, we get through it, we adapt, we move on, and we thrive. And it will be disruptive. It will change how patterns of how we do things. But as a human race, we will get through this. And the fact that we're having vaccines means we're going to get through it faster than if we just had everyone have to get sick. So that gives me hope. What gives me hope is the tremendous speed in which science has been generating new knowledge to treat, to diagnose, to screen, to prevent. I mean, the speed of innovation has just been unbelievable. And my hope is that, what we're seeing is people are collaborating across countries and institutions in ways that they haven't before. And I give hope that that hopefully will carry over and we actually maintain our public health infrastructure so that we will have another infectious disease. I mean, global warming, people moving around, animals moving around, we will have something else. So how do we learn from this so that we build systems and structures so that we are more resilient the next time? We talk about how great Asia did, right? By and large, they learned from the outbreak of SARS in the early 2000s, the N1H1 a decade ago, and they built systems in place and they were able to adapt to this pandemic with much greater resilience than because we didn't have to deal with those other outbreaks, right? So what brings me hope is that I have confidence in our science and public health system that we will learn from this and we will get stronger from it. And I have confidence in our human race that we will survive through this and we will come back to a time where we like to be with one another again. And maybe we've learned some new tricks and tips on how to work virtually better. Maybe we've gained greater awareness around mental health resiliency. And maybe we've gained greater re-awareness around health equity and recognizing that it's not just this pandemic, but all health. We have disparities in our country and we need to be doubling down on and raising the health of everyone. So I'm hopeful for those things.
Well, Dr. Elaine Morrato, you are in the right job. You are the right person in the right job. Gosh, we need people like you more than ever. It's so nice. One of the many things that gives me hope, Elaine, is that there's people like you. You're a smarty pants in the best way, helping the rest of us navigate this. And now you're part of an educational system at Loyola. And
Yeah.
yes.
Yes.
We need you.
Yeah. And remember, I'm not on the front lines treating patients the way nurses and physicians are. And these folks train to deal with emergencies and infectious diseases. And I hope that we all can honor them by taking good practices. So the wave right now, the uptick is going to really be affecting them in hospitals. And it's traumatic to be dealing with that day in and out. And so I hope that we also learn to come together as a society that supports one another. And when in doubt, what you were saying earlier, when in doubt, we should address the in a family, meet the needs of the person that's feeling most anxious or feels most at risk, and just honor that. Don't fight it. Don't just say, okay, I'll wear masks in the house, or whatever it is. Because we have to come together and meet people as humans, not just argue. So hopefully we come through this together in new ways. And one last thing, and maybe you're experiencing this, for those of us who are fortunate, it is allowing us to spend time with our children and families in different ways than we would have before. And maybe there's a silver lining in that. We're getting to spend more time with one another.
Right.
And
Well, let's end on what you said. You said we really need to come together and to treat each other as humans.
yeah, with grace.
Aw. Aw.
I know.
All right. Well, Dr. Elaine Morrato.
Thanks for having me. If others would like to, we're in on this as a journey. If you want to have another time when, down the road, we're all in on this together and learning as new information comes available, and happy to continue the conversation.
Well, you're a good decoder. Thanks for speaking English for
Yeah.
boneheads like me.
Well,
all right.
I
You're
hope it's
awesome.
helpful. All right. Happy
Everybody, thank you so
Thanksgiving.
much.
All
Bye-bye.
right. Bye-bye.